Dear viewers, we celebrate World Health Day on 7th of April every year. So first of all, we wish everyone, and especially our doctors, a very happy World Health Day. The theme for World Health Day 2024 is My Health, My Right. And we, the students of Gyanasthali'S Senior Secondary School, are here with our personal development initiative, Curiosity.
This interactive session between the students and doctors, we are also a teacher, but teacher for the MBBS students and PG students. School students interact with the doctor regarding the health issues or some very good questions. That is good for not even for you, all of you, even for us also, and everyone. Those are viewing or listening these interview or this interactive session, definitely some benefit for all of us and viewers.
So let's go and have a chit chat with our doctors. Good afternoon, sir.
Good afternoon.
So I'm really curious to know that how does it feel to be a doctor, and what has been your most happiest and most challenging moments so far?
I feel very proud to me and my family as a doctor, because I am dealing with the diseased persons in day-to-day life, and whenever I treat some diseased person or illness and that cured by my treatment, then I have feel very happiness inside, and not outside, but inside from my heart. I feel very better when my patient is better, by the disease. And another part of your questions is what is the happiest and challenging in my life. Till date, I have completed my 20 years of service and 3 years of my PG life. At the time of my PG time, when I was doing my PG course, the one moment is I remembering when my patient is admitted in my ward as a diagnosis of rheumatic heart disease, and I was sitting in my duty rooms, and from my duty rooms, patient can see directly, and sister came and giving some injections. After the injection, patient is going to in shock suddenly. Whenever I show the patient, patient is going to in shock, I going to recover the patients, giving as per my knowledge, I was giving treatment, adrenaline and whatever at that time my mind is think. After my trial or my effort, patient is very young girl, 16-17 years of age. Patient is recover. Patient almost going to shock, because sister giving some another injections that not giving properly. Patient whenever after the recovery of patient, when patient is smile and in healthy mood, I feel very happy. That is my happiest moment of my life, when I recover that type of patients, almost collapsed patients. So this is the very many times some challenging moments also in day-to-day life, more and more. Maybe in next future life, maybe more challenging way possible. But till date, I remembering the only one moment that is very challenging for me. That was the incidents.
Good afternoon, sir.
Good afternoon.
So my question to you is that there are so many diseases prevalent that occur due to lifestyle irregularity. So I wanted to know how to prevent such diseases.
Your question is very good, and for not only the diseased person but the healthy persons. First of all, you must know what the irregularity lifestyle, a bad lifestyle that induce the diseases. So in this case, you remember the rule of 5. So bad lifestyle induce irregularity in your life. Number one, that is lack of physical activity. Second, the when very unhealthy diet plans nowadays for kids and as well as whole the families. Third one is the use of smokings. Fourth one is excessive use of alcohol, and fifth one is lack of sleep, not proper sleep. So these five things that directly, indirectly related to health. So many diseases develop after in day-to-day life and for long-standing chronically when accept these type of lifestyle. So these five things that is very bad manners in the life. And what disease come after these bad lifestyles? The number one, obesity. That is the root cause of so many diseases. The obesity and dyslipidemia means raising or increase bad cholesterols. Number two, diabetes mellitus means especially type 2 diabetes that is related to obesity. Number three, BP and heart disease. When obesity, irregularity in the diet, then blood pressure is increased. The third one is BP and heart disease. Fourth one is cancer, some certain type of cancers that related to your lifestyle modifications. The bad lifestyle may initiate or triggering for the some especially cancers, GIT cancers, lung cancers, etc. And fifth one is increased risk of strokes. So these five things that may develop after you not care about the lifestyles. What you change in your lifestyle? Yeah, how to protect? So you five things. Number one, you plan your diet chart with the help of doctor or maybe some dietitian. But must be include balanced diet, carbohydrate, fat, proteins, minerals, as well as liquid diet must be include. Second, lifestyle means physical activity. Physical activity means at least 30 to 40 minutes in a day. You must include physical activity means exercise. Whatever you like, you running, swimming, whatever you like, but at least 30 to 40 minutes in a day, you have 5 days in a week. Third one is stop, cessation of smoking. If you use or in day-to-day life smoking, that you cut the smoking. Fourth one is if you limit, then limit the use of alcohol, otherwise avoid or stop, inhibit alcohol use. And fifth one is take a proper sleep. Sleep meaning proper sleep in a natural time, natural allotted time means 11 to 6 a.m. 11 p.m. to 6 a.m. is natural time, allotted time. So these five things, by applying in your life, you can protect lifestyle induced diseases.
Sir, it is very obvious if we are sick, we have to take some medicines and pop up some pills. But many times, due to some unawareness, people suffer from side effects of taking pills in a wrong manner. So, can you tell us what are the main precautions we can take while consuming pills?
Okay, sure. So first we have to understand that what is the over-the-counter pills. Okay. Now this is not now uncommon that people are going towards the over-the-counter medications. That is, they directly goes to some pharmacy or drug dispensary and they ask for the certain drugs like give me analgesic or the antipyretic without the prescription of the doctor. Now the problem arises that each drug have a particular dose, its duration for which the drug should be taken, and its related adverse effects and some probable side effects, which are very commonly abused these days, like analgesics. Analgesics are the major causes of some analgesic induced nephropathies, etc. So first of all, we all should know that every person has some drug allergy. So you should be aware about the drug allergy, if you are allergic to certain drug or not. Second thing, every drug should be prescribed by a registered medical practitioner only. Okay. So here the doctor will be knowing that what kind of drugs you are allergic. You are allergic to some sulfur drugs, etc. The third one is that every drug should be taken at a particular time of the day. So you should be aware about it, that how much time you can take the drugs. Like if you are taking an analgesic, then how much time, how many times in a day you can use it. You can't use it too much more than the prescribed time. Okay, so this kind of things should be taken in the mind. Another thing, if you even feel something like a skin rash or some unfavorable changes in your body after taking some pill, you should immediately consult to a nearby medical practitioner or government hospital or medical college like ours.
So, sir, my next question is that we read daily newspapers and also we see in our society that children go through anxiety and depression. So, my question to you is that what is the main reason behind this and how can we cope up with anxiety and depression?
This is also a nice question, that these days our youngsters are going through this anxiety and depression kind of things. First of all, we have to understand that why this anxiety or depression originates. It's all about the state of the mind of the kid. Okay, so all of us, even me or you or anyone, can go through these situations. So low mood is not a problematic thing, but for such things we should start with our talk to our parents. Okay, mother, father, with whom you are more connected, or you can talk to your friends about such thing. If something is problematic in your life or creating some anxiety inside you, talk to your friends, open up with them, open up with your parents. That's very important thing. But sometimes the mood or this anxiety is persistent, especially low moods for more than 2 weeks. It's not usual. So in such case, contact, first of all, tell your parents about the thing, and then with your parents contact a certified psychiatrist or some medical practitioner. Okay, in starting they will not go for the drugs. Okay, they will also counsel you, but that will be like a trained counselor, which will help you to cope up with these issues of anxiety and the depression. And in the last resort, in a very rare cases, they might advise some kind of drugs for some temporary time period for the betterment of the health. We also keep in our mind that we can prevent this kind of anxiety and depression issues via some lifestyle modification things. Like we should manage our sleep-awake cycle to a normal rhythm. Early morning, we should wake up and can use this yoga. Okay, these are also very very kind of refreshing things. And in this generation, even this use of recreational drugs is also not very uncommon. So kids and these youngsters should avoid use of this recreational drugs. And then proper diet is very important in keeping the mind healthy. Okay, so use proper diet. Don't go for these fast foods, and even these high oily foods with spices, and these also create some like disturbance in your gastrointestinal tract, which can directly or indirectly can affect your mental state also. Okay, and then the most important thing that I also have been explained, that open up with your parents. Okay, with friends, talk to them the problems you are sharing, facing. Talk to your teachers. Okay, so that can help in coping it and preventing this kind of issues in the youngsters. And I would also like to advise that we should avoid using too much time, is like spending too much time in the mobiles or computer screens. Other than this, we should even spend our times in outdoor games, like whatever you like crickets, football, volleyball. That will be much better. Okay, using these online games and this kind of mobile for long period of time is also associated with this kind of psychiatric illnesses in youngsters.
My question is to you is, my parents and everyone around me often tells me to maintain a good health, but I don't understand the real meaning of health. So according to you, ma'am, what is health?
Good afternoon. I consider this question as appropriate for you because the word health denotes it is not only the absence of disease, it is the three major domains which includes physical, mental and social well-being. And the absence of disease means it is the patient is healthy. It is not like that. Health domain includes three aspects. The patient should be, that person should be physically, he or she should be active, and there should not be any socially she should maintain good quality of life with the surroundings, and mentally also it should be there. So this domain includes three major criteria: physical, mental and social. It is not that if one person she is healthy and she is happy, it doesn't mean that person not free from disease, it doesn't mean that person is healthy. It includes all the aspects.
Good afternoon, ma'am.
Good afternoon.
Ma'am, my question to you is that it is often said that health comes with a proper hygiene, but there are so many diseases that occur due to unhygienic behavior in our daily routine. So, can you guide us some steps to maintain a hygienic life?
Sure. Hygiene, this is a good question, because hygiene is a part of the small thing which should be learned from a school curriculum, because hygiene is a small thing. If you take care of that, you can prevent big major disease aspects. For example, in school curriculum, washing the hands properly, even that is considered as a great hygiene, because your hands are the source of many infections. If we are washing the hands properly, we can prevent many, like acute gastroenteritis, drinking clean water. These are all basic things. If you drink clean water, then you can prevent many diseases like hepatitis or waterborne diseases, which can be prevented. So basic things like keeping nail, washing hands, cutting nails properly, taking bath, everything, it accounts personal hygiene. These are the things which prevents major disease exposure. And eating proper diets and doing regular physical activity, walking during school games period, these are all things for physical activity which helps to prevent diseases in major aspects. And personal hygiene starts from school curriculum, like washing your hands. I consider this as good question, because hygiene starts from the level of school level, because hygiene it should be implemented at the young age, because what you learnt in young age, it will be carried throughout. So in school level, hygiene, if you are washing clean hands is the main, because through hand roots there are many diseases. It is usually spread, like acute gastroenteritis and hepatitis, everything. So proper hygiene should be maintained. Wash hands properly before eating foods. Then personal hygiene, taking bath every day, hair wash, then after washroom, taking care of genital hygiene, everything is important. Moreover, keeping the surrounding is also important. Environmental hygiene is the main thing, because environment from any contaminated or water source, that it is a breeding source of mosquitoes, so it is more prone to develop infections. So personal hygiene as well as environmental hygiene is very important. These are the things which can be learnt at the level of school curriculum. So we should take more importance towards personal hygiene as well as environmental hygiene at the school level itself. It helps to prevent many more diseases, and we can stop at the earliest possible stage. In school curriculum, you are having that routine games activities, because physical activity is very much important, and it should be started at the young age itself, and it should be implemented and carried out throughout. Then personal hygiene, bathing, regular bathing, eating clean water, drinking a healthy life, following healthy lifestyles, and avoiding contaminated foods and roadside foods, which are the source of breeding and responsible for many infectious diseases. So these are the things should be cut down, and personal hygiene is very much important for every person.
So these were our saviors, our doctors with us. And once again, we wish everyone a very happy World Health Day. Thank you.
This interactive session between the students and doctors, we are also a teacher, but teacher for the MBBS students and PG students. School students interact with the doctor regarding the health issues or some very good questions. That is good for not even for you, all of you, even for us also, and everyone. Those are viewing or listening these interview or this interactive session. Definitely some benefit for all of us and viewers.